this video we are going to learn about the partograph. We know basically that is the partograph is the representation of the progress of the liver when we are going to take any intervention if the condition is not favored. So we have to know how to fill the partograph, what's the content in the partograph we have to fill. So basically the first content, that is the identification data. The identification details we have to fill firstly, that is the name of the patient and the age of the patient, what is the gravida parity, and the others like what is the parent's name, etc. That is comes under the identification data. Okay, the second thing that is we have to fill, that is the fetal heart rate. Okay, fetal heart rate is generally 120 to 160 beat per minute is taken as a normal. So the third one is we have to know the amniotic fluid. Amniotic fluid, if the membrane is not ruptured, then it is denoted as I, and if then the membrane is ruptured, then it denoted as R. And if the amniotic fluid, also known as the liquor, which is clear, then we have to denote as C, and if it is the meconium stain, then it is denoted by M. The next one which we have to denote it in the partograph, that is the cervix dilation. Okay, cervix dilatation is plotted in the XY like graph. Okay, we will see in the next video. We will fill the simplified partograph with an example. Firstly, we have to know the basic things, then we will going to fill. The cervix dilation is generally will filled after the latent phase, that is the active phase. In the active phase, that is the cervix dilation is more than 4 centimeter. When the cervix dilation is going to be more than 4 centimeter, then we have to fill the partograph. The next one is we have to fill, that is the contraction of the uterus. We have to fill in per 10 minutes. Okay, it is denoted like as if the contraction is less than 20 seconds, then it is filled like dot structure. Okay, and if is in between the 20 to 40 seconds, then it is denoted as the lines, and if it is more than 40 seconds, then it is denoted as the shading. Okay, and the next one is we have to fill if any drug we have given prior to the delivery of the baby, then we have to retain. And the seventh one is the pulse and blood pressure of the mother. Okay, we have to fill. And then the temperature of mother we have to fill. So this is the basic thing about the partograph. And the fetal heart rate is measured for every 30 minutes, and the amniotic fluid we have to check for every 30 minutes, you can also say. And the cervix dilation is for we have to check for every 4 hours. Okay, contraction is we have to check for every 30 minutes. And the pulse and BP we have to check pulse for every 30 minutes and BP for every 4 hours. If the condition is getting worse, then we can check BP for every 1 to 2 hours. Okay, and the temperature of mother is also taken for every 4 hours. So this is the basic thing we have to know about the partograph before we are going to fill. So thank you. In the next video we are going to fill the partograph with an example so that we can understand the properly. Okay, thank you so much.